Welcome back. Today we talk about autoimmune diseases. Disorders in the immune system. 1. Autoimmune diseases. Diseases of the immune system. They are divided into 1. Defect intolerance, causing immune cells to attack self-antigens, autoimmunity. 2. Excessive reaction to non-self-antigens, hypersensitivity. 3. Inefficient immune response, immune deficiency. Autoimmunity. Conditions in which immune reaction is directed against self. Occur due to breakdown of immune tolerance. It is a state in which the immune system is specifically unresponsive to self-antigens. Characteristics of immune diseases. Etiology, have unknown etiology, but genetic and environmental factors play a role in pathogenesis. Predominance, more common in females. Positive family history. Course, remission and exacerbation. Circulating autoantibodies. Treatment, by immune suppressive drugs as steroids, methotrexate and cyclosporin. Raynaud's phenomenon in autoimmune diseases. It is the change in colors of the fingers to white or blue. Associated with pain, numbness and stiffness of fingers. Affects few fingers of each hand. Positive in autoimmune diseases. Examples of autoimmune diseases. 1. Systemic lupus erythematosus, SLE. 2. Sjögren's syndrome, SS. 3. Systemic sclerosis, scleroderma. 4. Rheumatoid arthritis, RA. 5. Wegener's granulomatosis, granulomatosis with polyangiitis. 6. Pernicious anemia, autoantibodies to intrinsic factor causing VEAT. B12 deficiency. 7. Idiopathic thrombocytopenic purpura, ITP. 1. Systemic lupus erythematosus. Autoantibodies are released against self-DNA. Anti-double-stranded DNA antibody, anti-DNA-AP. Due to deficient complement proteins, the immune complexes deposit in tissues causing inflammation and tissue destruction. All body systems and blood cells are affected. Cardiac valves are affected. Inflammation of the diseased valves cause endocarditis, Liebman-Sachs endocarditis. Oral manifestations include red and white lesions that are similar to lichen planus lesions. Characteristic lesions on the vermilion border, lupus cheilitis. Oral ulcers. 2. Sjögren's syndrome. Autoimmune disease where immune reaction is directed to damage exocrine glands. Types. A. Primary Sjögren's syndrome. Xerostomia, dry mouth, plus xerophthalmia, dry eye, with no connective tissue disease. B. Secondary Sjögren's syndrome. Xerostomia, dry mouth, plus xerophthalmia, dry eye, plus other autoimmune disease of connective tissues, mainly rheumatoid arthritis, RA. In all cases, investigations show lymphocytic infiltration of the exocrine glands. Circulating anti-Rho and Antilla antibodies. 3. Systemic sclerosis, scleroderma. Autoimmune disease where immune reaction activates fibroblasts to release large amounts of collagen fibers. Characterized by excessive fibrosis to skin only or may also involve internal organs. Orofacial manifestations. Stiff face skin, mask-like appearance. Rigid lips. Limitation of mouth opening. Stiff tongue, difficulty eating and swallowing. 4. Rheumatoid arthritis, RA. Autoimmune disease that symmetrically involves joints causing their progressive destruction. Oral manifestations. A. TMJ arthritis, pain, limitation of mouth opening. In advanced stages, condylar destruction. B. Sjögren's syndrome may be associated with rheumatoid arthritis. C. Oral side effects of immune suppressive drugs. D. Poor oral hygiene due to inability to grasp the toothbrush. 5. Wegener's granulomatosis, granulomatosis with polyangiitis. Autoimmune disease where antibodies are released against neutrophils cytoplasm, antineutrophil cytoplasmic antibodies, ANCA. The AG-AB reaction causes A. Inflammation in small blood vessels. B. Chronic inflammation in tissues that form granulomas. General manifestations. I. Upper respiratory tract lesions, in the ENT region, ear, nose, throat. 2. Lower respiratory tract involvement, lung lesions. 3. Urinary tract involvement. Oral manifestations. I. Oral ulcers that may cause palatal perforation. 2. Strawberry gingivitis, granulomatosis in gingiva giving it this characteristic appearance. 3. Salivary gland involvement, parotid swelling. Dental management of a patient having an autoimmune disease. 1. The patient is susceptible to infections due to immune suppressive drugs. So, more frequent dental appointments for follow-up. 2. Long-term corticosteroid therapy causes adrenal suppression. So, modifications in doses should be performed by the physician before the dental appointment to avoid adrenal crisis. 3. SLE predisposes to endocarditis. So, antibiotic prophylaxis should be administered by patients having SLE before dental appointment. 4. Bleeding disorders may occur due to some autoimmune diseases, as SLE, or as a side effect of some immune suppressive drugs. So, consultation with the physician and management of the condition based on the platelet count. 5. Periodontal disease may be exaggerated due to the disease itself or due to inability to perform oral hygiene measures. So, appropriate periodontal treatment with frequent follow-up visits. The use of special toothbrushes with customized handles and special sizes to enable the patient to use it easily. 6. Oral manifestations due to medications. Oral ulcers. Pigmentation. Erythema multiforme. Lichenoid reactions. Gingival enlargement, due to cyclosporin. Thanks for watching. If you liked video, support us by subscribe and likes.